Hi, I'm Alexis Cate. I'm a licensed clinical social worker and trauma specialist. Let's talk about how to treat depression. Please make sure to check out the description below this video for all of the resources that we discussed today. Depression is a powerful mental health condition known to produce a range of severe symptoms that can threaten one's health, safety, and overall well-being. Using therapy, medication, or a combination of the two is generally what is recommended. Professionals are the best to consult in terms of what to do for oneself. It is found to be incredibly important to address depression sooner rather than later. Symptoms of depression range, and the dynamics of them are very unique to the individual. It is important to be able to identify symptoms that one is experiencing in order to begin treatment. Some common symptoms of depression include low mood and or irritability, low energy and increased fatigue, anhedonia or a lack of interest in generally enjoyed activities, feeling sped up or slowed down, feeling excessive guilt and worthlessness, changes in one's appetite, sleep, and weight, poor concentration and difficulties with decision making, and thoughts of death, dying, or suicide. Please know that if you or someone you know is suffering through suicidal thoughts, help is available by dialing 988. For a depression overview, we've linked a video in the description below. There are depressive symptoms that can absolutely be rooted in physical illness. Medical conditions could create new symptoms, worsen existing symptoms, or even masquerade as depression when there is really something else going on. Once other variables are ruled out and depression is confirmed, treatment options available like psychotherapy. Having a therapist and someone outside of your general everyday life that you can trust is extremely healing. Therapists can support you in modifying unhelpful thoughts, feelings, and behaviors that may be contributing to depressive symptoms. Medications. Various psychiatric medications work to adjust our brain chemistry so that the neurotransmitters that we really need are firing. And this provides a healthier balance overall. Brain stimulation, electrical currents, magnetic fields, and other stimulating procedures to trigger wanted brain changes and decrease depression. Natural options. Natural options include herbs, supplements, and other natural remedies with a history of providing support to people experiencing depressive symptoms. Lifestyle changes, diet, physical activity, sleep changes, and other healthy habits can support one in reducing symptoms of depression. With depression treatment, there are many paths toward recovery, and you do not have to be stuck to just one path. Paths can be taken together, and paths can be mixed up in order for them to be best for you. Many treatments do integrate together to provide a comprehensive treatment plan. And the more comprehensive a treatment plan is, the more likely there will be results. Therapy is often the frontline treatment when treating depression. For many, therapy is accessible and comes with low risk as an option to address unwanted symptoms. Even better, health insurances regularly pay for established and evidence-based forms of therapy, and often a referral is not needed in order to start. To learn more about the different types of therapy for depression, we've linked a video in the description below. Many people also benefit from a combination of medication and therapy. Medications for depression, called antidepressants, these work to increase the amount of certain chemicals in our brain that might be missing and leading to the experience of depressive symptoms. Just like with therapy for depression, there is no one medication that is universally prescribed. However, with continued innovations, many medications can provide relief of symptoms. It is important to work closely with your provider in order to ensure that medication is doing what it is meant to do. Numerous studies show that therapy and medication combined are one of the most effective ways to treat depression. However, adding lifestyle changes and self-help strategies are also incredibly effective, and these can only enhance the benefits of professional interventions. A person with depression can gain additional power and control over their symptoms with these 7 self-help strategies. Exercise. Increased physical activity will naturally increase the wanted neurotransmitters in our brain, such as serotonin. Improved diet. Without a balanced nutritional diet, the body cannot form new brain chemicals to fight depression. When building a balanced diet, Plan to eat healthy foods, drink enough water, avoid sugary beverages, and also eat foods with probiotic to support your gut health and digestive system. Focus on good sleep. Sleep is essential to restoring our mental and physical self from the day. And people who lack sleep tend to see life through a more negative stance. Limiting alcohol and other drugs. Using substances like alcohol, marijuana, and other drugs may seem to relieve symptoms of depression in the short term. However, they actually have been shown to worsen symptoms of depression in the long term. Find ways to reduce stress. Reducing stress can look like engaging in relaxation techniques, breathing exercises, and maybe cutting back from responsibilities that you actually don't need to take over and can be put on another person's plate for a change. Cultivating healthy relationships. Depression can cause a strain in healthy relationships, so it is very important to devote more time to your relationships. You can also consider joining a support group, enrolling in a class, volunteering your time, or even bonding with a pet to foster healthy relationships. Find a purpose. Hopelessness is greatly linked to depression. While having a purpose and feeling useful can be challenging, it is incredibly necessary, so go out and find it. Remember, above all else, treatment for depression can be incredibly effective. People may often feel discouraged or let down. However, depression will not alleviate without consistent dedication to treatment. Even if a person feels far from it, achieving your goals is possible. At times, symptoms of depression can become severe, and a person may require inpatient hospitalization. With inpatient hospitalization, one is living within the hospital on a mental health unit for a period of time. They receive treatment from psychiatrists, social workers, therapists, nurses, and other supportive staff until their symptoms have improved and their safety is more secured. In most cases, inpatient stays are brief, and a person can follow up with other levels of care after the hospitalization ends. Some reasons to seek hospitalization for depression include thinking about or planning to harm oneself, thinking about or planning to harm someone else, being unable to care for your health and well-being effectively, experiencing extreme paranoia, hallucinations, and delusional thinking due to depression that is associated with psychotic features. People may voluntarily seek inpatient hospitalization by calling a local crisis line or presenting to the emergency department. Help is available by dialing 988. However, at other times, people will require an involuntary hospitalization. And this is where depression is causing such severe symptoms, such as suicidal ideation. However, a person is struggling to accept the fact that hospitalization is necessary. And therefore, doctors will sign off on the approval of inpatient hospitalization on behalf of the patient in order to secure their safety. Final thoughts on depression treatments. No one can predict what depression treatments can work or not work for them until they give it a try. As long as people enter the treatment process with an open mind, some patience, and persistence, they can reap the benefits in order to effectively manage their symptoms of depression. We've linked some resources in the description below to help you find a therapist, psychiatrist, and other useful tools.